Next, we have poster 9, titled Community Prevalence of Chronic Kidney Disease Among Wet Zone Farming Population in Sri Lanka. The authors are Nayanamali MAA, Erandika HGN, Hevapatirana HPM, Pushpakumara WRAM, Basnayaka BMDP, and Nanakara N. The presenting author is Nayanamali MAA.
Good morning all. I am MAA Nayanamali from University of Peradeniya. My topic is community prevalence of chronic kidney disease among wet zone farming population in Sri Lanka. CKDU is a public health problem which is associated with poor health outcomes, and this study was conducted to identify the prevalence of chronic kidney diseases among the wet zone farming population in Sri Lanka. This was a cross-sectional study. We recruited 522 adult participants in the age category of 25 to 60, and the total purposive sampling technique was used to recruit the participants during a series of screening programs conducted in Mathurata area. And our results, when considering the results, the participation ratio male to female was 1 to 1.91 male to female ratio, and 44 participants of the 552 participants were reported with high serum creatinine level, and among those 44 participants, when considering their comorbidities, about 23 participants were identified without hyperglycemia or hypertension, and some participants with high serum creatinine level were presented without hyperglycemia and hypertension. And our conclusion is that there are several other causative factors for the causation of CKD, chronic kidney diseases, than diabetic mellitus and hypertension. Thank you.
Thank you. The paper is now open for discussion to both the judges and the audience.
So according to study, can you just tell us what are the ascending order, what are the causes as you found?
Thank you, sir, for the question. For the CKD, there were several factors like hyperglycemia, hypertension, diabetic mellitus, hyperglycemia, hypertension, and snake bites like causes.
With regards to diabetic mellitus, have you assessed how long does it exist? That means with the history of what was the
Yes, it is not there in this slide, but we assessed the history of the diabetic mellitus. There were several patients with a small history, and there were
what is the cutoff limit you recruited into the sample?
Sorry,
so
sir.
What was the cutoff limit? That means with at least what duration you included into the sample?
No, this was a screening program. We did a screening programs where we recruited patients in the age category of 25 to 60, and from that
with any amount of history of diabetic.
Yes.
In the absence of further questions, please give a round of applause to our presenting author.